everyone. Welcome to another week of psychological testing for pastoral counseling. We are gradually moving forward uh, in this class. Let me quickly say at this point that all the assignments have been posted on our platform. So please check your platform to see your papers that you'll be working on. Feel free to make a selection of whatever you want to work on. All right, and I hope you will enjoy writing this time. Okay, so for this week, our focus is assessment of emotional and mental disorders. Uh, Assessment. How do we assess emotions and mental disorders? Uh, for example, we are talking about depression, anxiety, trauma, stress. We're talking about the screening tools, pastoral care integration. Now, why assessment matters in ministry? Now, pastoral leaders are often the first people individual turn to when they experience emotional or mental distress. Why pastors are not clinicians? They play a crucial role in the following. Number one, recognizing signs of distress. Number two, providing spiritual and relational support. Number three, knowing when to refer, to make a referral. Number four, reducing stigma. And number five, supporting ongoing care. All right. We don't, if a pastor is not a registered psychotherapist or psychologist, or you know, you are not expected to treat any mental health illness. But in most cases, you are the first person people turn to. And the role you are to play are 5 points I just highlighted. Recognizing signs, providing spiritual and relational support, knowing when to refer, reducing stigma, supporting ongoing care. These are the pastoral role. Assessment is not about diagnosing people. It's about understanding. It's about listening. It's about guiding people towards appropriate help. So, pastoral care stands as an intermediary between the people and professionals. That is the role. So we need to understand key emotional and mental health disorders as we move forward. We will focus on 4 common categories for the sake of this lecture. And when we're talking about common, we're talking about depression. Depression is very common. Anxiety is very common. Trauma is very common. And stress-related symptoms or conditions are very common. People are going through depression, anxiety, trauma, and stress. Let's look at depression. What are the core features of depression? Persistent sadness or emptiness. That is one of the signs of depression. Number two, loss of interest or pleasure. In those things people used to enjoy, they begin to lose, some interest and pleasure. Number three, fatigue and sleep changes. There will be some fatigue and sleep changes. Number four, feelings of worthlessness or guilt. Feeling of worthlessness and guilt. Number five, difficulty concentrating. It's difficult to concentrate. And number six, thought of death or suicide. Some may tell you, I don't want to be here again. I don't feel like being here again. They may not tell you directly that I want to kill myself or I want to die by anything. They just tell you when they say, I don't want to be, I feel like I don't want to be here. That is saying something. Okay. Looking at the pastoral consideration. Now, depression often carries spiritual shame. I shouldn't feel this way if I trust God. You hear people say that, why am I feeling this way? So sometimes it comes with guilt. All right? It comes with, spiritual shame. Number two, pastor can normalize the experience, reduce stigma, and encourage holistic care. Okay? And number three, when you hear SI, suicide ideation or suicidal thoughts, take it seriously and make a referral immediately. Don't keep quiet. When you hear people telling you, I don't feel like being here, or I feel like killing people around me, I feel like killing my family members. When you hear this kind of things, you don't keep quiet. Right? Let's look at another one, anxiety disorders. What are the core features of anxiety disorder? We have excessive worry. People continue to be worried, restlessness, tension, raising thoughts, physical symptoms, this heart rate and sweating for some people, stomach issues for some people, and avoidance behaviors. Those are the core features of anxiety. Let's look at pastoral consideration for this. I want to tell you that anxiety is not simply a lack of faith. It's not a lack of faith. Also, pastor can help individuals explore spiritual resources without minimizing psychological needs. So you can help people to find resources, but we must not minimize psychological help or needs or support. Another point for consideration is that we must encourage grounding practices, prayers and professional supports. You should suggest all these things to clients. Let's look at another one, trauma or post-traumatic syndrome disorder, PTSD or trauma. When we are talking about trauma and PTSD, we're talking about their core features as intrusive memories or flashback. Intrusive memories, and flashback. We are talking about avoidance of reminders. Avoidance of reminders. We are talking about hypervigilance. Hypervigilance. We are talking about emotional numbing. People don't want to feel it. They numb the feeling. Numb it. We're talking about changes in mood and cognition. These are the core features of trauma PTSD. For pastoral consideration, trauma survivors may struggle with trust, including trust in God. Trauma survivors, people who have experienced trauma, who escaped trauma, may struggle with trust, including trust in God. Pastor must avoid pressuring disclosure or spiritualizing trauma. Please, don't force this disclosure. Don't spiritualize trauma. It is when the client is ready to talk. You need to wait for them to talk. When they're not ready to talk, don't force them to talk. This is very, very important. And of course, trauma-informed care, usually emphasizes safety, empowerment, and choice. In psychotherapy, there's something called trauma-informed care. All right? Not all counselor or therapists or registered psychotherapists can treat trauma. Not all. Okay? If you are not trauma informed, you will not be able to treat anyone who is experiencing trauma PTSD. Looking at the next one, stress and adjustment issues. Stress and adjustment issue. What are the core features of stress and adjustment issue? Number one is the feeling of overwhelm. You feel overwhelmed. Irritability. You feel irritable. Sleep disruption. Difficult coping with life changes. Physical symptoms like headache and fatigue. Whenever you are going through stress, any of these can be there. And what are the pastoral considerations? Stress is often cumulative. It's not just one time thing. Sometimes you have accumulate them over time. And pastor can help people or individual identify boundaries, support systems, and spiritual practice that promotes resilience. That is our duty. That's our duty. Let's look at the screening tools. What are they and how they help? Pastor do not diagnose, but pastor can use simple, validated screening tools to identify severity, guide referrals, track changes over time, support conversation. Please, these are areas very, very important that we need to take note. So we are not to use those tools to diagnose anybody, but our duty is to identify the severity of the situation, to guide people to make referral, to track changes over time, and to support conversation. So let's. I will just give you one example of the tools we can use. I know some of you have been asking me about all these things. I will just give you few, one condition, the tool you can use, and the purpose. So I'll just tell you that, for example, now, depression. When we talk about depression, there is PHQ-9. PHQ-9. With that, it helps to screen the severity of depressive symptoms. The severity of depressive symptoms. PHQ-9. Okay. And for anxiety, we have GAD-7, General Anxiety Disorder 7, GAD-7, which measures generalized anxiety symptoms. GAD-7. For trauma, we have PCL-5, or Trauma Screening Questionnaire, which identifies PTSD symptoms. PCL-5, or Trauma Screening Questionnaires. For stress, the tools we use for stress is PSS, Perceived Stress Scale. PSS, Perceived Stress Scales, which is designed to measure subjective stress level. PSS, that's what it does. So screening tools do not equal diagnosis. They are conversation, status, and referral guides. Conversation, status, and referral guides. Integrating screening with pastoral care. Looking at it from the pastoral role, pastor provides the following. Number one, presence. Number two, listening. Number three, prayer. Number four, spiritual guidance. And number five, community support. Number six, encouragement towards professional help. I will list it again. In pastoral role, what we are expected to do is to give our presence, to provide our presence. Don't be too busy to attend to them. Listening, you have to be good listener, active listening. Praying with them right there and after. Okay? Providing spiritual guidance, community support. There are a lot of community that has provision for mental health issue. Let's make a referral. Let's use our connections to connect our members to encourage them to go. They may not want to go, but we can use our connections to encourage them to go. And of course, encouragement towards professional help. How to use screening tools in ministry. Now, number one is that we need to introduce them gently. Sometimes this questionnaire helps us understand what you are experiencing. So we need to introduce them gently. We need to review results together. Okay, you are reviewing the result together with them. You are focusing on themes, not numbers. Themes, not number. Number three, normalize the experience. Normalize the experience. Many people struggle with this. You are not alone. That's an example. You tell them, they are not alone. Many people are going through this, they are not alone. You normalize the experience. And number four, you design the next step. You know, the mind symptoms to pastoral care, monitoring, the moderate symptoms to pastoral care, counseling referral, severe symptoms, with immediate clinical referral. These are things that we are to do under pastoral. And another thing is collaborate with professionals. So, with permission, pastor can coordinate care with therapists or physicians. This is very important. And this overview may not complete without talking about the ethical and practical considerations. What are the ethical and practical considerations? Number one is confidentiality. We talked about it. Pastor must protect the privacy. Why knowing when safety override confidentiality? That is, confidentiality has limitation. When somebody is having suicide ideation intent or plan, you can't keep it confidential. You need to, do something about it. Otherwise, it will be too late. So confidentiality is important, but it has limits. Referral, that's our duty. Pastor should maintain a network of Christian counselors, Christian psychologists, Christian psychiatrists, crisis services. All right? We must have this referral list around us. Another thing is boundary. Pastor are spiritual caregiver, not therapists. Healthy boundary protect both the pastor and individual. Don't go far beyond you should go. You are not trained to undo this kind of care. So please, let's be careful the boundary so that we don't cross it. All right. Let's look at the conclusion. This is just an overview. All right. When it comes to holistic approach to emotional and mental health, effective pastoral care integrates compassionate presence, basic assessment skills, use of simple screening tools, collaboration with mental health professional, and of course, spiritual resources that promote hope, and resilience. So, pastor, don't replace clinicians. They only complement them. Together, they help individuals move towards healing in body, healing in mind, and healing in spirit. So these are a few things I want to tell you about the assessment tools, the assessment of mental health and emotional disorder. Please take time to read The assigned reading for this week will help you to capture some of the informations we are trying to pass across. If you have any question, feel free to let me know. If you have any concern, feel free to send message to me, and I will talk to you very soon. Bye, everyone.